When you think about businesses that are selling through the roof, like Skims or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling and for shoppers buying simple. For millions of businesses, that business is Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Upgrade your business and get the same checkout Allbirds uses. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. Shopify.com/income.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we're going to talk about one of my favorite things. Yes, you guessed it. The pelvic floor. We're going to talk about the pelvic floor during pregnancy and birth and postpartum. Let's understand what are signs and symptoms that you need to see and get specific help for your body other than just some of the do-it-yourself things at home. And we're going to talk about what actually happens at a pelvic floor physical therapy appointment. So you probably guessed it. I recommend all the time to students to get that personalized help. And I had a student after class kind of settle up to me and said, I appreciate that you're always offering pelvic floor PT as additional support. But she said she was hesitant because she's like, what actually happens there? So I thought, let's do a podcast where we talk about what to expect at a pelvic floor PT. How are you assessed? Is it internal? Is it looking at you from the outside? Is it all the above? How does that work? So we are going into depth on that. Now, to have this conversation, I have a former student. Her child is 16 years old, so quite former ago. But I have Dr. Amy Stein. She's a premier physical therapist and is at the forefront of treating pelvic floor dysfunction and pelvic pain and specializing in functional manual therapy for all people. In addition to being the founder of Beyond Basics Physical Therapy, Amy has served as the president and is currently on the advisory board of the International Pelvic Pain Society. As an award-winning author, Amy has written books on pelvic pain called Healing Pelvic Pain and Endometriosis, Beating Endo, How to Reclaim Your Life from Endometriosis. She's created a video on pelvic pain, healing pelvic pain and abdominal pain. Amy is also a co-editor of Healing in Urology, as well as a featured author in many medical textbooks, including Pelvic Pain Management, Female Sexual Pain Disorders, and Evaluation and Management, and Management of Sexual Dysfunction in Men and Women, and the Overactive Pelvic Floor. Amy is very well versed and very accomplished, and we have a really wonderful conversation about the pelvic floor. Before we get into that, as always, I love to give you my updates of Prenatal Yoga Center. Honestly, everything's just kind of cruising along. We've got our online classes, our in-studio classes, our workshops. So this is something that actually someone wrote in about. We have a full schedule of workshops at the studio. We've got our childbirth ed, our lactation, our infant safety CPR, and then someone actually emailed saying, I mentioned these at the beginning of the podcast, but most of them are in New York City. So yes, many of them are, but we have a whole on-demand library. So if you are not living in the New York City area, which means you're likely not coming to our childbirth education class, I got you covered because we have the same workshop on demand, so you can take it from home on your schedule. We also have our teacher training online so that no matter where you're in the world, we can study together. And I'm really proud of this training. So if you're into the idea of educating yourself on prenatal yoga, I've got you covered on that too. And then last thing is just a thank you. Thanks for being part of our community. And I ask you, when you have a moment, to leave a rating and review so other people can find our podcast. Thanks again for listening. We're going to take a super quick break. When you come back, please enjoy my conversation with Dr. Amy Stein.
Mothers know all about life's tricky transitions. Thankfully, Ollie helps you prioritize wellness through every age, life stage, or magnificent mood change. Need a multitasking multivitamin that keeps up with you? How about an essential prenatal for you and baby? Ollie's got you through it all. Life's tricky. Your wellness routine shouldn't be. Get what you need at ollie.com.
Hi, Amy. How are you?
I am great. How are you today?
I'm doing really well. It's funny because I was thinking, I'm like, ooh, do I call her Amy? Do I call her Dr. Stein? Because years ago, and honestly, I can't remember, you'll know because it's the age of a child, but you were at PYC. Like, this is like way long ago. How old's your child?
16.
Oh my gosh.
And we moved, and the only reason why I stopped coming was we moved all the way downtown.
Yeah. And it is, I get it. The subways are a pain, but I'm really excited to speak with you. I have your book, like I've referred people to you. So it's really fun to reconnect and have a chance to chat. So thanks for being my guest.
Yes, this is amazing. Thank you for having me.
So knowing I love all things pelvic floor, I'm so excited to learn a little about you and what led you to pelvic floor PT. So share a little about yourself, and because not everyone thinks pelvic floor when they think becoming a physical therapist. I'd love to know your story.
Sure. So over 25 years ago, when I was in PT school, I had a friend that had a hysterectomy, unfortunately, and she ended up with severe pelvic pain afterwards. And by the way, now they've improved the surgery. They know where to go and where not. So I don't want to scare anyone. But she was having severe bladder, bowel, and sexual dysfunction after the surgery, and the physicians didn't know what was going on. They ruled out UTI, they ruled out a back, anything going on in the lumbar spine and the tailbone. And I went to my professors at the time because I was in school, and at a problem-based learning school, by the way, and I said, my friend's having this problem. They ruled out the back. They ruled out any infection. They ruled out any organic issue going on. What could it be? And being at a problem-based learning school, they put it back on me and said, well, what do you think it is? And I was like, well, I don't know. That's why I'm asking you. So from there, I just started looking into like pelvic floor dysfunction. I noticed that the nerves of the pelvic floor were lower down and not where she had the MRI, so in the sacrum area. And from there, I just got interested, and I realized that you could have a pelvic floor dysfunction, and all of these tests come up negative. Mm-hmm. So that was, and then when I moved to New York City, I met her surgeon, and we started talking about pelvic floor, and we realized how there's such a void. There was no one really understood pelvic floor dysfunction, and no one really understood how to diagnose it, how to treat it. So I started getting interested in learning more about it. And within a year of me graduating from school, I had a full schedule of pelvic floor patients, and I was really interested in learning more. And from there, that's how I got involved. And it's been a growing experience ever since, because it's still evolving to this day. And I think it always will be, but we know so much more than we used to than 25 years ago.
Absolutely. I remember when I first started Prenatal Yoga Center, which is now 22 years old, there wasn't much information, and I did different trainings, and I even did a couple of pelvic floor trainings. And I feel like in the last 10 years, I've learned so much more. How does the pelvic floor impact pregnancy, birth, and postpartum?
So with pregnancy, with pregnancy, you do get that change in the center of gravity. So your whole core system is shifting a bit. And you do want to try as best as you can to make sure that everything is balanced. And your core consists of your pelvic floor, your abdominal, your abdomen, your abdominal muscles, your back, deep back muscles, and your diaphragm. And obviously with the pregnancy, again, the abdominal muscles elongate. So things are shifting, and you want to try to make sure that the muscles are as balanced as possible. Some aren't getting too tight. So it's really important to keep the pelvic floor balanced as well. And that could typically with pregnancy, the muscles, they do need to be a little bit stronger so that they could support the pelvic organs, the baby, etc. With postpartum, then there's a shift in the other direction where now you don't have that baby in the belly, so the center of gravity shifts again. So then the whole core has to shift with it, and the abdominal muscles are lengthened a bit. They do return to their pretty much back to where they were before, but there's a shift. So it's important to try to make sure you're doing the exercises at that point correctly. And that includes the pelvic floor. If there's been any type of prolonged labor, if there's been a C-section, if there's been any type of tearing, then there could be an actual injury to the pelvic floor. And even a C-section, because of where the pelvic floor is, the abdominal muscles, the fascia of the abdominal muscles connect to the pelvic floor, so that can be influenced as well. So all in all, it's very important to keep the core as balanced as you can throughout pregnancy and then postpartum. And then just if you are unsure what's happening, that's where a pelvic floor physical therapist comes into play.
Mm-hmm.
If there is any like weakness or the opposite, we see the opposite as well, some discomfort, some pain, that's also where pelvic floor physical therapy can be super helpful.
So I want to talk about a bit of a controversial conversation, Kegels. So when do you think they're appropriate? Because I also know that, you can't just isolate a single muscle. Everything kind of works together in a sense. So a lot of the students I end up working with start to realize that their pelvic floor is actually really tight. And so when are you using Kegels? When do you feel like they need to be kind of left to the side and other muscle groups need to be paid more attention to?
I like to break it down into two different categories. So again, the pelvic floor, just for anatomy's sake, it connects from the pubic bone in the front to the tailbone in the back and out to the sides to the hip area. So it basically creates a bowl, if you can imagine a bowl. And you do want those muscles to be you want tone, so you want some tone just like the rest of your body, but you also don't want them to be too tight. So like if you were to have a back spasm, those muscles in that area get tight. And actually with that, you don't want to keep tightening them.
Mm-hmm.
So that would be more the overactive pelvic floor. And with the overactive pelvic floor, if those muscles are tight, uncomfortable, if there's any bladder bowel, like urgency, frequency, any type of pain, sexual pain, bladder pain, then treating the muscles as if they, again, are tight or spasmed, you need to address that first before you can even see if the muscles need to be strengthened. So that is something that is challenging for people to assess on their own. That is again where the pelvic floor physical therapist comes into play, because they can assess the muscles to see what's happening with them. Are they weak? Are they too tight? Are they shortened in any way? And then you have the other side is the underactive pelvic floor. That is easier to assess on your own. That's when your muscles aren't strong enough. And when you cough, sneeze, laugh, or do yoga or do any type of lifting, you leak. And those muscles you can actually assess on your own. You can, the next time you go to urinate, you can assess them by squeezing the muscles. And if you're able to hold back the urine, like stop the urine stream, then that's a Kegel. But catch of that is only do that as a test, because if you do it every time while you're urinating, it confuses the messages to and from the brain. But once you get to know those muscles well, then you do the Kegels when you're not urinating. So like even during a yoga class, you can incorporate them into your yoga class. So I hope that was helpful. Basically,
Yeah.
again, overactive means the muscles are too tight or restricted in some way. Underactive means they're weak and you may be experiencing like some leaking, even decreased orgasm. That can happen too from weakness in the pelvic floor muscles. So again, definitely important to differentiate them, because with the overactive muscles, we do stay away from doing Kegels until we assess that the muscles are at their optimal length to do the Kegels.
Yeah, I agree with all of that, because I know too many times a care provider will be like, oh, you're pregnant, start to do your Kegels. And then students come in, they're like, I have tailbone pain. It hurts with penetration. It hurts when I poop. I'm like, oh, I bet your pelvic floor is tight. So let's stop shortening a tight muscle. But I feel like people also, I have so many different ways I describe how to engage the pelvic floor for those that need it. And yet I still sometimes see people just like clench their butt. I see them clench their jaw. So I would love to hear how you would describe, should you prescribe Kegels to somebody, how do you describe it? Because I always am looking for other ways. I mean, I also pull out a pelvic model and I'm like, imagine a blueberry. You're pulling it up your vagina like a straw. Draw your anal sphincter like you're stopping from passing gas. But you probably do this all day long. How would you describe engaging the pelvic floor to do a Kegel?
Those were actually great examples that you gave. I
Thanks.
use the pearl as a
Oh,
instead
I
of,
like a pearl. That's better than a blueberry.
so lift the pearl. Also, yeah, like you said, holding. I use hold back, like you're holding back gas.
Mm-hmm.
And I still have patients that they're like, wait, how do I do that? So it's not that easy. It's not that straightforward for some people. So the example that I gave before, the urinating example, that's probably the one that's most like easiest to see. But again, only do it as a test. So I tell my patients do it like once or twice a week to test it while you're urinating. And if you can slow the urine down by engaging those muscles, so basically what you just said, squeezing around the sphincter, lifting the pearl or the blueberry, then that's a Kegel. So if you could slow the stream down, that means that the muscles are working, but they may be a little weak. If you could stop the urine, then that means that you are able to fully engage the muscles. They still could be weak though. So that's when I would prescribe actual exercises. And how I describe it is it's similar to like doing like bicep curls or back extension exercises for a weak back. You need to do repetition, and you ideally need to do, there's two different types of muscle fibers in the pelvic floor. There's the slow twitch muscle and the fast twitch muscle. And the slow twitch muscle, you want to do longer holds. So maybe like 6 to 8 seconds. And then the fast twitch muscle, you want to do like a 1 to 2 second hold. Though the fast twitch is when you are actually about to leak, like with lifting, you want to make sure you can do that quick squeeze. And that's an exercise in itself. You do a squeeze and you do whatever the exercise is, or the jumping jack or the running that's causing the leaking. But I do want to add one more thing before we continue. that you want to make sure that you're also relaxing the pelvic floor after you do a Kegel. So it's a squeeze, a lift of the pelvic floor muscles, and a relax.
Mm-hmm.
Lift and a relax. What I sometimes see is the patient just repeatedly does the Kegel, but they never fully relax. So then you're not going through that full range of motion, which is so essential to strengthening any muscle in the body, including the pelvic floor.
Yeah, we focus a lot on the relaxation because I feel like there's a lot of anxiety around pregnancy. So people's nervous systems are already very active and their bodies are in a very kind of fight or flight. So we work a lot on getting into that parasympathetic nervous system, diaphragmatic breathing, and letting go of their pelvic floor a bit. Oh, I love this stuff.
Yay!
Yeah, I know. I'm such a geek on this. I feel like I missed my calling, but we're going to talk about why I didn't totally go into that when we talk about exams. So, what are some of the signs that someone they need to address the pelvic floor beyond the kind of do it yourself at home? Like, we're prescribing what I call the 360 breathing. We're giving different strengthening for the hips and glutes and hams and teaching them how to relax. But there's only so much that I can do with the broad strokes as a yoga teacher. So when they're no longer in their do it yourself, how do they know like enough's enough? I got to go see a PT.
I would say if that isn't working, and sometimes it does, like I know you mentioned my book earlier. I've had patients on Amazon. If you look at the comments, like they'll just read the book and do it on their own, which is awesome. That's great when that happens. But I would say if you're still feeling any type of tailbone pain, any type of unexplained back pain, any type of bladder, bowel, sexual symptoms of pain, pain with emptying, pain with penetration, with bladder and bowel. If you're having urgency or frequency that just isn't improving, definitely seeking out a pelvic floor physical therapist. If you're not emptying completely, so you go to urinate and it's slow or it stops and starts, or you feel like you haven't emptied. Same with the bowel. If you go to the bathroom and you feel like you haven't emptied, then that's when to seek a pelvic floor physical therapist, because that's just indicating that the muscles, again, are too tight or shortened, or there's like a spasm in the muscle that needs to be addressed. And Kegels can actually make that spasm or tightening worse if the muscles are too tight or restricted.
Mm-hmm. No, that makes a lot of sense. All right, let's jump into the appointments, what they look like. But first, we're going to take a quick break. When we come back, all right, let's talk about what happens at a pelvic floor PT appointment. We'll be right back.
O'Reilly. Need a little help? O'Reilly Auto Parts can help. Need advice? We've got advice. No matter what you need, we have thousands of professional parts people doing their part to make sure you have it. Exceptional customer service. Just one part that makes O'Reilly stand apart. The professional parts people. O'Reilly Auto Parts.
The wait is over and your new baby is here. But it didn't come with an instruction manual. That's why there's Newbies. We help guide new mothers through their baby's first year of life. Listen as newly postpartum moms celebrate the excitement of becoming new parents and share the emotional and physical struggles of recovering from childbirth and caring for a newborn baby. Subscribe through your favorite podcast app and visit newmommymedia.com to check out our other parenting shows, Preggy Pals, Parent Savers, Twin Talks, and the Boob Group. Newbies, new moms, new babies.
Okay, we're back. So as I mentioned, I'm always telling my students, okay, go to a pelvic floor PT, figure out, because also like some people are going to have a combo pelvic floor, which can be really confusing. But the hesitation sometimes comes from when students are like, well, what exactly is going to happen there? So can you describe what happens during a prenatal or postnatal pelvic floor physical therapy session?
Sure. So patient comes in, and the number one thing that pelvic floor PTs should be aware of and the patient should be aware of is that you want to feel comfortable with your pelvic floor PT. It can be an uncomfortable scenario, but the pelvic floor PT should make the appointment as comfortable as possible. And we do a subjective, so we want to hear what's going on with you, with your symptoms, when it gets better, when it gets worse, if certain positions make your symptoms worse. Then we'll go into a deeper history of, prenatal, postpartum care, delivery, etc. And then we'll ask the questions of bladder, bowel symptoms, pain, any type of pain that you're experiencing. After that, we look at the posture. So we look at alignment. We look at how you're walking. Because even with weakness, there could be like weakness in a hip that's influencing the pelvic floor. There could be weakness in the back, especially the TA muscle with pregnancy. That's the transverse abdominal muscle. That's one of the deep muscles. That is part of the pelvic floor. I think I forgot to add that before, but that deep abdominal muscle is really important to make sure that's strong too. So we look at all these different things, the range of motion in your hips and your back. And then we do assess the muscles surrounding the pelvic floor. So the abdominal muscles, the back, the thighs, especially if there has been a previous surgery, any type of abdominal surgery, or a C-section. We do want to assess the muscles and the tissues around the C-section. And then we do assess the pelvic floor muscles. And that does involve an internal pelvic floor exam if you feel comfortable. If you don't feel comfortable, there is a lot we could do externally that can address the pelvic floor muscles. There's also something called biofeedback, which does not hurt at all. And you put 2 electrodes around the perianal area, and you ask the patient to contract and relax. And we do ask them to bear down just to see if they're able to do that. By the way, that's also really important to know how to do for delivery, which we would love to see patients prenatal and postpartum, so that we can assess all these different things, so that we could avoid certain any type of pain or discomfort a patient may be having, or any type of injury. Could definitely help with avoiding some injuries. So that is more or less the exam. If the patient does feel comfortable with the internal, it's similar to a GYN exam. We are able to go with the patient's comfort level. So if they are experiencing any pain, we'll go nice and gentle. We assess the external pelvic floor first, and then we assess the internal if they feel comfortable. Another thing that women do have an advantage of, positive or negative, we are also able to assess the muscles rectally if they feel too uncomfortable with the vaginal exam, but they feel more comfortable with assessing the muscles rectally. So lots of options. And again, it doesn't have to be internal if they don't feel comfortable. But I do find that most patients, by the time they come to us, they want the full assessment. So yeah.
That was actually when I'm going to just put myself out there. When after my son, I pushed for 5 hours. So my pelvic floor was a hot mess. So I saw Dr. Pamela Morrison, and she was very blunt. She gave me a great exam, did the biofeedback, and was like, yep, you're strong in the superficial, but not in the deeper. I'm like, didn't know that. Okay. And that's where the internal I thought was helpful, because it could be really specific. So if people are uncomfortable out there, I get it. Because at first I'm like, this is strange, but it gave really good feedback that I don't know if it could have been assessed other ways.
Yes. Yeah, definitely. I agree with that. And I know Pam very well, so I'm glad you got the help that you needed, because it's hard navigating pelvic floor dysfunction. Do I go to a urologist? Do I go to a GI
Oh,
doctor?
I did it both. I did everything. I was just
Yeah.
like, after pushing for 5 hours, I'm like, my pelvic floor is down by my ankles. I need to take, I mean, it wasn't really, but I'm like, I need to take care of this. But it was really interesting about how she built a program really just for me. So after you assess someone's pelvic floor, how do you build a program for that client?
We build it based on what we find in the impairments. So if the patient, for instance, slouches a lot or just sits back in their seat a lot, we'll make sure that we address posture, and we'll talk about that and the importance of posture, the importance of movement, making sure that they are exercising, but pain-free exercise. We don't want, even if there's pain in the pelvic floor, we don't want you to be running or walking when you're experiencing pain or weakness, or any type of leaking, because if you feel uncomfortable with that. So we definitely tailor the program to the patient. We add some stretching if there's certain muscles that are tight. We add some gentle strengthening if there's certain muscles that are weaker, especially with when you are pregnant and postpartum. The abdominal muscles are weaker because they did lengthen, but we want to get them back to where they were before pregnancy. So that is also what we help with, and we tailor those specific exercises to each patient because everyone is different. We also add some pelvic floor. If there is tightness or restrictions or pain, we'll add some relaxation. If the patient feel comfortable, we'll educate them on how to massage the muscles externally. We can educate them on how to massage the muscles internally as well with a therapeutic wand. In addition, with strengthening, if there is weakness in the pelvic floor, we'll educate on what first. I do it very systematically. Okay, let's isolate the pelvic floor. Let's figure that out first. Work on that for a week or two, and then come back and we'll reassess. Then we'll start to add other exercises to strengthen the muscles around the pelvic floor to make those strengthening exercises more functional, so that when you go to lift your baby, when you go to yoga class, or if you want to go back to running, we'll tailor those exercises specific to what your goals are and what your needs are.
That's perfect. I love that you make it so personal for what they're showing up with. So when should someone start pelvic floor PT during pregnancy? Do you have a point where like, no, it's too early, or is it all hands on deck at any time to help the pregnant person?
I feel like it's all hands on deck. I would say if you're not experiencing any symptoms, which most people are at some point, even if it's just neck pain, back pain, I still do get frustrated when a patient comes in and is like, I have significant back pain. I could barely walk. But their GYN just says, "Oh, that's fine. Just wait the 5 months, and then your back pain will go away." No, that's not okay.
Yeah.
We want to make sure you're comfortable, and PTs can help with not just with pelvic floor PT, but we could also help with back pain. We could help with neck pain or hip pain. So I ideally coming in sooner rather than later. If you aren't experiencing symptoms, which is great, I still recommend coming in because there's so much that we can learn, which is what I actually was going to add to the home program and the tailoring to the individual, is that if you're constipated, which a lot of people are with pregnancy, addressing that constipation, making sure you're not straining. If you are not emptying the bladder well, making sure we could teach you how to like relax the muscles so that you empty better, not rushing to stand up and go to work or whatever, making sure you're taking the time for yourself. Even with constipation, things like the squatty potty, though, all these things can be really helpful for patients prenatal and postpartum. So I'm a big advocate of, even if things are going great, which I hope for everyone they are, seeing us ideally second trimester, third trimester, at least once, and then postpartum to make sure that there's if there was any tearing, if there was C-section, if you did have to push for a very long time, what is going on with the pelvic floor? If you are feeling back pain, let's address that sooner rather than later, so you're not having the discomfort. One thing I do want to add is, with prenatal, during pregnancy, we also want to make sure you are able to bear down. I have patients that they get confused with the Kegel versus the bearing down. It's called a paradoxical contraction, and teaching them making sure that they understand what bearing down is, not in the moment of delivery, is really important, as well as doing a perineal massage, which I think you may mention to your clients. And you can even do, if you're comfortable with it, some perineal stretching the 4 weeks prior, just to get the muscles prepared for delivery.
One thing I wanted to add about one reason I think it's great to see a PT during pregnancy, even if they're not having symptoms, help them not have symptoms, is because a PT can really assess the body, because we know that during pregnancy, the forward weight's going to shift the hips forward. They're probably finding more anterior pelvic tilt. So then we're getting more tension in the front and weakness in the back and tightness in the lower back. And that kind of some rippling effect. So if we're like popping the ribs out, we know that's going to affect the pelvic floor. So I think it's a great idea, just so that the PT can look individually and be like, all right, where do we need to strengthen? How can we help your alignment? Because I think too many people think, oh, I'm pregnant, I just have to waddle down the street. But they don't have to. We can build strength elsewhere to counter that. So it's almost like, you know how we see a therapist, even though you might not be totally depressed, you're just like just maintaining a check-in. I kind of feel the same thing with a physical therapist. It's just helping status quo remain okay. That's just kind of my perspective.
I agree. I agree. And then also, to add to what you just said, the hormonal changes that are happening, your ligaments are relaxing more from the relaxin hormone. So that could cause some instability in your SI joint or in your hip joints. So that's really important to address well, and making sure you're doing exercises to maintain the stability that you've had throughout your life.
Yeah.
So we want you to be able to move and do all the things that you were doing before you got pregnant.
So let's jump to postpartum. So what are some signs that someone should see a pelvic floor PT postpartum? Because you mentioned some like leakage and pain and C-sections. Anything specific? Because I know one thing, I was looking this up, and I've known this for a while, but some countries just prescribe pelvic floor PT regardless of the method of birth and symptoms. It's just for good rehabbing. So how should someone know if they should see one, or should they just be like, I had a baby, let's get things checked out?
I agree with, I had a baby, let's just checked out, because it's a health and wellness, and we're very much more into wellness than we were when I first started doing this. And if we could catch any type of impairment earlier on, it's easier to fix earlier on. So if there was, even if you're not experiencing discomfort, ideally, that's ideal. But if there was like tearing, or they did have to do, if there were stitches, we want to see that area, C-section, or if there was a episiotomy, we do want to check out that area sooner rather than later. One, to make sure there's no infection. That's one thing, because a lot of the GYNs say, oh no, come back in 6 to 8 weeks. And we've had patients that are there's an infection coming along, and we want to address that as soon as possible. But also to make sure that the tissues are moving well, to make sure you're moving well too, just your whole body in general. Another thing is with bottle feeding or breastfeeding. There, a lot of patients will say, I'm having discomfort like in my neck. So teaching them proper posture, proper positioning, all these things can be really helpful postpartum. And they could, again, seeing patients sooner rather than later can help avoid things down the line, like scar tissue that's not moving well, or the back muscles are really tight, so they're not able to, if they have a diastasis, then they're not able to engage those muscles as well because the back muscles are too tight. And then the pelvic floor, if there's any type of tightness, which can happen even postpartum or discomfort because of any type of tearing, we do want to address this as soon as possible. Give you a home program. Some of it can be done telehealth, because I know it is really hard for new moms to come to PT sessions. Mm-hmm. So ideally, we want to see you at least the first visit in person. But
so when would that first visit be? How soon can someone start?
I've had patients come in, I wouldn't say the first week, but even the second week, they're having like significant back pain, or they are having a lot of pelvic pain, and we need to go ahead by their GYN on when we can assess the pelvic floor muscles internally. Also, a C-section, we want the go ahead by their OBGYN. But if they are experiencing pain, if they're experiencing constipation, we can start to give them ideas, behavioral modifications, some exercises to do at home so that they could at least get the ball rolling. Mm-hmm. And then once we get the go ahead from the OBGYN, then we can do the rest of the assessment.
That's so great. Yeah, I saw one pelvic floor PT. I think it was like 10 or 11 days postpartum. She was not helpful. She's like, your chakras are spinning in the wrong way. And I'm like, that is not helpful. I am peeing myself. That is not helpful. And that is how I then ended up seeing Pamela, who is much more straightforward.
They could have been, but
they may have been spinning the wrong way, but that is not what I needed to hear at the moment. I need to be like, talk to me about muscles. Where are they falling apart? I think that's why I have such respect for pelvic floor PTs, because I know it can really affect the quality of one's life. I know, again, I'm just going to put myself out there, but my first child, with how much pushing I had and how tight my pelvic floor was from overdoing things and also too much hypermobility, I really wanted to understand the muscles. I wanted to understand what was happening, because it was devastating to me to have not just such pain, but the incontinence and the heaviness. Like it really affected me in the beginning of postpartum. So I think that's why it's so important for me to get this information out there so that people know who to go to, not just trying to push their way through and be like, oh, this must be postpartum, but really know that there's things they can do. So I'm so happy for people like you.
Oh, thank you. And we're happy for people like you, because it is so important to everything that you mentioned before, just even reiterating that, even if they are seeing a pelvic floor physical therapist, the idea of relaxation and knowing where the pelvic floor is, and then just the movement that you do is amazing.
Oh, thank you. Okay, we're going to take another break. When we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? We'll be right back.
You were probably expecting one, but got pregnant with two. We get it. Twin Talks encourages moms who are expecting twins, as well as experienced moms of multiples. Together, we'll explore the unique challenges new parents face when raising two or more children of the same age. Join us as we embrace the joys of parenting when you've got double the duty. Subscribe through your favorite podcast app or say, "Hey Alexa, play the Twin Talks podcast." And be sure to visit newmommymedia.com to check out our other parenting shows, Preggy Pals, Newbies, Parent Savers, and the Boob Group. Twin Talks, parenting times 2.
Okay, we're back. So I'm very curious if you're going to use your role as a mother or your role as a PT. So what is one final tip or piece of advice you'd like to offer new and expectant parents?
I have been fortunate enough to be able to join those together. What happened with me as a mom, a new mom, not new anymore, as well as the PT part. I want to say first, I have a couple tips.
Sure.
First, definitely give yourself credit, take your time. Know that if you are going through a lot, this is part of the process. Get as much help as you can. If you do need to go to pelvic floor PT, which again, if you're experiencing any type of discomfort, or even in the back or neck, anything like that, getting to the PT, seeing if you can have someone to help you. Even in our office, we allow babies to come here, and one of us, if the parent feels comfortable, one of us can help if we can. So definitely taking care of yourself is important, because if you take care of yourself, you could then take care of the baby as well as the family. And also trying to seek the right type of help is important. And if you do have questions, knowing that most places you should be able to call up and ask to speak to someone to see if they can answer your questions. So those would probably be my tips. And also knowing that fortunately there has been so much more research on pelvic floor, on women's health. We do have a long way to go. We still are not there yet, unfortunately. But in the 25 years that I have been doing this, the research has really expanded. And my own knowledge has expanded tremendously since I started years and years ago.
Thank you for those great tips. Where can people find your work and your book?
My book is called Heal Pelvic Pain, but it does go over what I explained earlier, the overactive, so the pain conditions and the frequency, urgency, but also the underactive. So even if you are experiencing some leaking, getting the book, Amazon has it. I'm not sure. Barnes and Noble, they're not around anymore. Anyway, I would say just Amazon. It's like $10 on Amazon. I think there's a Kindle version, but I'm not sure if that has the photos. But definitely getting that to at least get yourself started. And then my office is in New York City, Midtown and downtown, Beyond Basics Physical Therapy. And we do put a lot on our social media and website. So Beyond Basics PT for the social media, as well as the website, Beyond Basics Physical Therapy. We do try to put out a lot of helpful information for your own self-care and to guide you towards your healing.
That is great. I'll make sure all that's in the show notes. Amy, it was so great to reconnect after all these years. I think you sent me your book when it first came out. So I have probably one of the the first original go-arounds. You signed it and I still have it. So thank you so much for that. It was great to connect.
That was great to speak to you, and I hope to see you soon.
Yes.
Thanks so much for having me.
You're so welcome. Thank you.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.
You've decided to give your baby breast milk. We want to help. We're the Boob Group, a group of moms and experts here to support you in your goals, whether you're breastfeeding, pumping, or something in between. Each week, a group of experienced moms openly discuss their success, their struggles, and society's impact on how they feed their babies. We provide an honest, natural, and judgment-free approach to breastfeeding, pumping, milk sharing, and more. Subscribe through your favorite podcast app or say, "Hey Alexa, play the Boob Group podcast." The Boob Group, where moms know breast.